Greetings, friends and followers. This is Nurses Talking. I am Deborah Z. Today, I am speaking with Ms. Meryl Fury, who is a registered nurse and a nurse entrepreneur, and has her hats and her hands in many different community and nutritional projects. So, welcome, Meryl.
Thanks, Dale. So nice to be with you today.
Thank you so much for speaking to me today. I'm so wanting to talk to you, and I'm so interested in what you have to say because I know you have a lot. So let's start there. I know you're a nurse, and why are you a nurse? How come you're a nurse?
Oh,
what made you go into nursing?
You know, that's a loaded question, right?
Yes.
Okay, so I am one of those people that never really wanted to be a nurse. I wound up in the field like by accident almost.
Mm-hmm.
When I was a kid and people would ask me, what do you want to be when you grow up? I kid you not, literally, I would say, I don't know, but I don't want to be a nurse, literally. And that went on for a long time. And I thought nurses, I had this idea of what nurses were, that they were quiet and they were graceful and they, you know, could walk in and out of sleeping people's rooms without waking them up, and they could open cabinet doors silently and all these things. It was a poem I read a long time ago, and that's the way the nurse was described. And when I read it, I don't know how old I was, but it just said that I'm not that person.
Yeah.
I'm a bit.
Yeah.
I'm not a quiet person. So I figured I couldn't be a nurse because of that. I did study, though I have a fascination with human health.
Mm-hmm.
And so by about age 15, I found myself studying a lot of nutrition and herbology and natural health methods, and that continued for a long time. I did go to the University of Texas at San Antonio and studied more about physiology and pathophysiology and anatomy, comparative anatomy, all those fun things, because my real goal was to go on to be a doctor of natural medicine.
Okay.
Sometime between the time that I was taking those courses and I could actually get to Washington State, was the only accredited school for natural medicine at the time, the John Bastyr College, I found myself pregnant.
Mm-hmm.
And had to, well, okay, what do I do now? Yeah, switch course, oops, plan B, what are we doing, right?
Yeah.
And I remember I was walking across the university campus one day, and it was a relatively small campus. I was going across like the central quad area,
Mm-hmm.
and the nurse recruiter for University of Texas, San Antonio, stopped me as I was walking through. And she said, Meryl, I want to see you in my office tomorrow, 1:00. And I thought that was odd. Why,
Yeah.
Okay. But I was a fairly obedient person, and, okay, you asked to see me, I'm going to go see you. So I went to her office the following day, and she sat me down and she said, I think you should be a nurse. And I said, I'm not interested in being a nurse. I've never wanted to be a nurse. And she said, well, I think you need to be a nurse.
It's the thing.
And I was like, okay, tell me why? And she proceeded to run down that she knew I was pregnant, that she knew the baby's father was not really contributing. She knew that I wanted to be able to provide for my child to a certain level of like consistency and reliability, right? She knew that I had already been taking all these allied health courses, and I had dang near all of the prerequisites for nursing already. And she knew her skill, her trade, which was get more nurses, because of course there's always been a nursing shortage for a long time.
Mm-hmm.
So she said, this is what I know about you. She painted this picture. And I said, well, what if I don't want to be a nurse? She said, look, you have to provide for your child. This is a way you can do it legally, legitimately. Yeah. You can provide for your child very well. So she said, here's what I want you to do. You're going to go to the community college this summer. You're going to take statistics with Professor whatever his name was. You're going to get a B. Then you will apply to the University of Texas Health Science Center at San Antonio. You will get admitted, you will go through school, and you'll get your bachelor's, and you will always be able to provide for your child. I tried to argue with her, Dale. I tried. There was no arguing. She had all the answers, and I had none. So that's what I did.
You had no answers and the baby coming.
No kidding. No kidding. Yes, double that. So I wound up going and finishing my nursing degree. I got my bachelor's in nursing and have well been able to provide for the children, and life carried on and things got better. So
Yeah, I can imagine. So, Meryl, so having been pushed or dragged into
yes.
it, what challenges did that present for you?
Okay, so like I said, I'm not a quiet person, right?
Mhm.
How you see me is how I am all the
I
time,
know.
right? I tend to make a statement just by walking in the room, even if I don't say anything. And given that what I will say is my true calling
Mhm.
is in the realm of wellness and natural health, right? I like to help people prevent illness. I like to see people robust and strong and healthy on the well end. I'm certainly willing to help people migrate to the well end.
Yeah.
But given that that's my bent, to go into nursing where it's a lot of very ill people,
Yeah.
was difficult for me. It was hard, you know. I found myself there. I was with my bachelor's. I went into public health. So I was doing home visits, mother baby things. I did some home health. The mother baby was probably the easiest part because that's the well end of the spectrum again.
Yeah.
Um, and then being in public health, you know, it's very constrained by what the government allows and doesn't allow. It's the federally qualified healthcare system and health center system is it's got a lot of rules
Mhm.
laid down by
Mhm.
the federal government. And one of the things that happens in those facilities is it's like everywhere, you know, medicine is a fee for service business, so you have to keep people coming back.
Yeah.
You know, you got to come back every
Mhm.
3 weeks, every 3 months, it's once a year, it's 6, you know, every 6 months, whatever it is. Every illness or stage of life has its schedule for
Yeah.
coming.
Yeah.
And all of the time we have patients coming back like that, we rarely talk to them about how to recover their health, how to reverse their illness,
Mhm.
you
Mhm.
know? And that's really where my heart is. I want to teach people, look, this is what you do in your own home. This is how you develop your own autonomy and agency around your own health. You don't have to come to a clinic and have somebody
Tell
do
you.
it for
Yeah.
you,
Mhm.
because
Mhm.
basically that doesn't work, right?
Yeah.
So I found myself speaking out in ways that I probably shouldn't speak out. And
Yeah.
certainly by the time I got to be a woman of a certain age, I totally lost my filter and I was saying all kinds of stuff that, woo, I probably shouldn't have said, at least shouldn't have said to the people that I said it to. And
Mhm.
yeah, so that was the challenge I found, having the orientation I have and the personality that I was gifted with.
A woman of a certain age, she said. I love it.
You know, Dale,
I
you know,
know, I know. I could
that's part of
totally
the,
relate. I could totally relate, Meryl. There comes a point in your life where you say, this one is just going to come out. I
that's
don't
right.
have to worry about what comes out. It's going to come out.
That's right. You know, and I've been biting my tongue for so many years now, and what difference has that made?
Mhm.
None, right?
Mhm.
Exactly none, or things have gotten worse. So, okay, I'll just say what I have to say.
All right. So let's jump forward a little bit because I know that you're an entrepreneur. I
Yes,
know that you have a business. Your business is called Balance Forward Health and Wellness.
yes.
Okay. And the first thing that struck me about this business was the name of it, Balance Forward. And I said, well, what made her choose that name?
Uh-huh.
So,
Well, couple different things came together. So spirituality wise, I'm a Buddhist
mm-hmm,
and always in meditation, and part of Buddhist philosophy actually is looking for balance. Like we call it equanimity, right?
mm-hmm,
And not being attached to things is, you know, just maintaining a sort of that zen thing, you know, that
Yeah.
chill
Mhm.
about things. So that's part of it. That's what balance is about for me. Partially in meditation, I usually am seeking balance with life, with family, with work, with, you know, my own internal workings, you know, balance in the body.
Mhm.
I was also looking for a name that had two meanings, a double entendre, right? So I chose that balance forward because it is an accounting term, where in accounting, as far as I have been able to understand, because I'm not an accountant, is we take the sum total of what we have, the
Mhm.
positives and the negatives, right? The profits and the losses, and you put those together, and that's your balance. That's what you have. And when you take a balance forward, it's that moving into the next billing cycle or the next cycle that you're
Mhm.
in.
Mhm.
So for me, that's what it is. We take the sum total of what we have as people with our positives and our negatives and our strengths and our weaknesses and our strengths and our foibles, and we move that forward. And that's kind of what the name means for me.
Mhm. So it's balance forward health and wellness, and you are teaching people what with this?
Primarily, I focus on nutrition. I have the Balance Forward Health and Wellness, that's a for profit.
Mhm.
And then I also lead a nonprofit called Plant Based Nutrition Movement. I'm president and CEO of that.
Mhm.
That actually gets the bulk of my time. The the nonprofit work just calls me, you know.
Yeah.
I would say even though I never wanted to be a nurse, over 30 years I grew to be a public health nurse,
Yeah.
right?
Yeah.
And so I have this very strong passion for populations that are just challenged with maintaining their health or accessing healthcare. Um, so I wind up in both cases, in the for profit business and in the nonprofit, working with people who want to recover their health, and it is primarily through nutrition. So we work with whole food plant based nutrition. We do not advocate for animal products at all. I just flat basically ignore them. I don't talk about those.
Mhm. Mhm. Mhm.
The beef and dairy and pork and egg industries have plenty enough people hawking their wares.
Talking about. Mhm.
Mm. So we recommend fruits and vegetables and whole grains and nuts and seeds, legumes and mushrooms, and that's what we work with. And we have fair success, you know, helping people reverse their diabetes and reverse heart disease. It's an amazing um, body of knowledge to understand and be connected to the healing capacity of natural and healthy food. Um, you know, food does for us something that medications cannot do.
Yeah. Yeah. Yeah.
So that's what we work with in both cases.
So, so how hard or how easy um, is it then to, because as you said, you try to, you work a lot with marginalized populations, and so if you're working with people who traditionally may perhaps have been eating, number one, have been eating a certain way, and number two, probably don't have a lot of resources,
Mhm.
um, and we know that, at least in our heads, if not in fact, the
Mhm.
leaning towards a more healthy diet tends to be a little bit more expensive. How does how do you get people to buy into this?
So first we dispel the myth that it's more expensive. Mhm. So there's two ways to look at that, right?
Mhm.
I don't know anything more expensive than having to buy insulin and Lipitor and all of that every month.
Mhm.
That
Mhm.
is some expensive stuff.
Uh-huh. Mhm.
And it's only covered if you have insurance, you know, it's only covered to a certain degree. You're always going to have your deductibles in there,
Yeah.
unless you're a member of Congress or something like that. Maybe you could get away with it. Um, so first, that's the first thing.
Mhm.
Another way you could look at that is I don't know anything more expensive than a major heart attack with a coronary artery bypass and some
Mhm.
stents. That's
Mhm.
expensive stuff. And to
Mhm.
get your chest cracked open down the middle, whew, that's even That's taking a physical toll as well as
Mhm.
it all takes a physical toll, but that's a big one.
Mhm.
So that's one way to look at it. And then even without all that, there's beans and rice. That's some pretty inexpensive stuff,
Food,
you
yeah.
know? Broccoli,
Mhm. Mhm.
kale, squash,
Mhm. Mhm.
tomatoes.
Mhm.
That stuff
Mhm.
is really inexpensive, and it actually is medicinal. You can make it taste great. That's the beauty of it. But it's actually food that we use as medicine. There's nothing, I can't compare costs. Even if you buy, okay, let's say now, and I don't really buy beef, so maybe if you do, you can tell me. Price
Mhm.
per pound for beef, last time I checked, was somewhere around $8 a pound or something. Is that what it is still?
I think it probably still probably around that.
Yeah. All
Maybe
right.
more.
It might be more.
Maybe more.
Okay, so let's say for 1 pound, you can feed four-ish people the way Americans eat, right? We figure it should be a quarter pounder burger,
Mhm.
right?
Mhm.
Eh? So you're going to feed four people for $8. If I go to the store and I buy a bag of lentils, let's stretch it and say it's $1.49. I buy a bag of rice, oh, let's push that and say it's $3. That'll feed a family of four for a couple of days.
Mhm. Mhm.
It's not really that expensive. Where we run into trouble is if we start buying all these exotic ingredients and these plant-based meat things and, all
Mhm. Mhm. Mhm.
the
Mhm.
what we call the upscale fufu, shishi, that kind of stuff. That's expensive.
Mhm. Mhm. But there are a lot of people feel that when they start shifting to a plant-based diet, that's what they have to do.
Yeah.
Um,
So
so
no, that is not right. A plant-based diet, really what we say are foods with no labels.
mhm.
If you're out there buying things in bags with bright colors that say vegan, plant-based, whole food, buy this, but you're already slipping into vegan junk food, the mass market of vegan buzzwords that
Yeah.
people are,
Yeah. Yeah.
really the most wholesome and healthy food that we can buy, the stuff that reverses heart disease, literally, and reverses diabetes, no joke. Those are cruciferous vegetables, Brussels sprouts, kale, collards, go with some fruits, apples, tomatoes, avocados, get some nuts and seeds, whole grains. That's what you're looking for. Those are
Good.
that's medicine from the gods, right?
Yes. Yes.
Yeah.
I'm so glad you said that. And so I know that you have a particular interest
Yeah.
in children and nutrition.
Yes.
So
Yeah.
tell me about it.
Oh my gosh. Gail, let me tell you. This stuff brings me to tears on a regular basis. So if I start I have my tissues here. So if I start having to block my eyes,
Well,
you'll
I have some here in case you make me join you with the tears. So
okay.
okay.
So having spent as much time as I spent in public health, and that was close to 30 years, doing home visits, managing clinics. I even worked on the flip side, the insurance company
Okay.
side
Mm-hmm.
for Medicare and Medicaid. It is shocking when you get to see it from those perspectives, how the most vulnerable populations are handled for healthcare, right? Really shocking. And one of the things that I noticed over time, and for some reason it's just been really crystal clear to me lately, is that across the board, I don't care where the people come from, how much money they make, what color they are, what language they speak, the most vulnerable population we have are children. I don't care if you're a multimillionaire or you're homeless and with nothing. Children they're dragged from wherever you drag them with you, right? They don't have any say.
Yeah.
Again, no autonomy and no agency. They have nothing. They have to rely on the people around them and the environment, right? And a child left outside alone to figure it out for himself will die. A 5-year-old, 8-year-old,
Yeah.
7-year-old is a rough spot. So most recently, what we're creating at our nonprofit, the Plant-Based Nutrition Movement is the name of the nonprofit. is a rather large project to have an impact on child nutrition. One part of the project involves working inside of schools, and I kind of do it like this, right? So it's working inside of schools, teaching children directly, this is the type of food that is good for you to eat. Why do you want to eat this? Okay, it's Brussels sprouts. I know Brussels sprouts have a bad reputation, but you should try them, right? So try them different ways. Or this is a range of citrus fruit. Yep, there's lemon, there's lime, there's tangerines, there's oranges, miniolas, blood oranges, caracara oranges, grapefruit. There's so many different kinds. How many have you tried? Oranges alone. Okay, well, let's try a spread. You try these and see what you think. And then we have coloring sheets and workbooks, and we do the whole lesson. So that's what happens in schools. On top of that, we have another project. Oh, wait, I should back up. The name of the project is 6 Million Seeds. The 6 has to do with the 6 plant-based food groups, right?
Okay.
So there's fruits, vegetables, nuts and seeds, whole grains. Let me see if I can remember them all. Legumes and mushrooms. Okay. That's 6. And then the SEEDS is an acronym that stands for Students Educated in Environment, Diet, and Sustainability.
Okay.
So our goal is to get kids, and by extension, their parents, to understand the importance of eating healthy food, as opposed to cheese doodles or Cheetos or Twinkies or Twizzlers or Oreos or pepperoni or that kind of stuff, right? All right. So then on top of that school-based project, we have a podcast also called 6 Million Seeds, where we talk to, and it's about to launch. The first episode will go live next week, Monday, where we talk to people who are fairly well known in the field, doctors, educators, climate change activists, all about the impact of food on the human body, as well as how we eat and how it affects the planet. The third part, much bigger entity, is that we are building a movement. And the movement is to create a decade that is focused on child nutrition specifically. We are enrolling, getting engaged with national organizations, international organizations, again, individuals, small, large, all. Because if we wait for Congress to make child nutrition important, we'll be waiting a very long time. And if we wait for the UN to declare it, girl, it may never happen. So it's very much a grassroots movement, and that's what we're actively working on now. So the idea that we could make a difference with child nutrition, and I'll tell you even further, rather long answer to your question.
That's all right.
Back in, I think it was October or November, the United Kingdom spent some money and had some people do some research to find out what would be the behavior changes needed so that we could actually get to net zero carbon emissions by 2030.
Yeah.
2050. That's a 20-year jump, right?
Yeah.
And one of the things that this group came out with was some behavior changes that needed to happen. The paper was actually put online along with the UK's net zero proposition. But when they realized that this research paper had been put out about human behavior changes needed, they pulled it down. It was taken down inside 3 hours of being published. I was able to get a hold of the paper because, nothing lives on the internet without being recognized.
With that.
Right? So I was able to get a copy of it. And there are 2 things that they recommended that people do. One is reduce your air travel. Okay, you can see that. The other was reduce your ruminant consumption by 35%. Every man, woman, and child. Reduce ruminant consumption. That means decrease your beef, right? Your mammals, right? So and that's to get us to net zero by 2030, which I think is kind of important. If we want to have a planet to live on, we should do something, right?
Yeah.
So our goal is that if we can get every child, and by extension, every family, to reduce their ruminant consumption by 35 to 50%, maybe we have a chance of helping reduce this climate chaos that we're living in now.
Yeah, 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 yeah. You know, when you mentioned, you know, climate change and sustainability of the planet and all of that, but when people talk about it, that does not come up.
No, it doesn't.
That
What
does
we
not
talk
come
about
up.
is fossil fuels. We talk
Yes.
about, yeah, the petroleum. No, what they say now is the biggest actor in climate change and what's causing the biggest greenhouse gas producer is animal farming. That's anywhere, depending upon what paper you're reading, it's, you know, anywhere from 30 to 80% of the problem. So let's drop it in the middle. Okay, 50% of the problem.
Mm-hmm, mm-hmm, mm-hmm.
I'm good with that. That's what I do. I don't eat animal products. And I try to encourage other people not to too, because for crying out loud, I want a planet for my children to live on.
Yeah, indeed, indeed. And a planet that is a healthy planet.
Yes.
A healthy planet for them to live on, not just the planet, because you know the planet is here and probably will be for a long time, but our health is not very healthy at the moment.
No. How long will it sustain life like this? You know, it's
Mm-hmm.
something. And then that people could be healthy on a healthy planet. Wow.
Mm-hmm. And you know, really, that really, if you think about it, that really should be a simple concept. But I'm not sure why it's so difficult for us to get to. Well, I do know. There are
Yeah.
some things like greed and avarice and all these kind of things that get in the way. So I do know, but
Yeah, true that.
yeah, yeah. So I was going to ask you, what is your big vision? But I mean, you just described this big vision to me of, you know.
Let me tell you, Miss Dale, my big vision is that I'm going to call you on the phone and I'm going to say, Dale, you want to do this thing with me? Come on, let's go.
And I go, yeah.
Because that's how it's going to go. It's going to be a grassroots thing.
So now, but having been through, and I'm going to come back a little bit to the nursing thing, because having been through that, you know, as someone who got into that, which was not really your comfort zone, even though you stayed with it for an extended period of time and it wasn't really your comfort zone, what would you say though? And you know, nurses are necessary. Nurses ain't going anywhere. Nurses are necessary. So being able to look at this from both ends, what would you say to someone who wants to be a nurse?
You know what
What
I would
advice
say?
would you give them?
More power to you. Do it. Do it. If that's where your heart is and that's where your passion is, yeah, because we need nurses.
Mm-hmm.
Nurses are the healers, right?
Mm-hmm. Mm-hmm.
In the hospital settings, it's the nurse that's there doing it.
In just about every setting. In
Yes.
just about every setting. And the longer I live and the more I do this, the more I know it.
Yeah.
In just about every setting. And we're talking about, again, I'm so happy that I'm able to talk to a nurse like you, because very often we don't see ourselves and the public does not necessarily see us as people on the preventive end.
Right.
You know,
right.
And I think that we need to be able to participate in this whole healthcare thing, not just as a reactive thing, but as a proactive thing. So we need to do that much better.
That's one thing I would say for a nurse going into it. If you are a person who's, you know, I mean, how can I say that? Okay, let me back it up a little bit. In the medical world, nurses were very well educated. You know that. We have to know all kinds of math and science and physiology, anatomy, all that, blah, blah, right? But when we're in the medical world, we take orders. We for a while developed this thing called, you know, nursing practice and nursing diagnosis, and we used to write up a nursing care plan and all that. In the length of time I was a practicing nurse, I don't think I used that after I left school. In the medical world, then nurses take orders, and we wait for someone to tell us what needs to be done. Very often, I'm not saying always, but very often. And then we execute the order with excellence, right? And then we wait for the next thing to come. We're that's if nurses could learn and act on being more proactive,
Yes.
carry it forward, do something with all that stuff we have in our heads. Oh my goodness. And all that unspoken, that ability to walk in a room, excuse me, and sense things
See it.
about what's going on in the room, smell
And
what's
see
going on
it.
in the room. Yep, you get it in your body, right? You can feel it. It's like, oh, I remember one time I went to visit a family. I was doing home visits, and I got to the bottom of the stairs of the house. Was a one floor walk up,
Yeah.
and I'd been knocking on the door, and no one was really answering. And finally, I knocked on the door, and somebody yelled out, "Who is it?" And I'm yelling up, "It's the nurse. I'm here to visit the baby." This went on for 3 minutes, back and forth. "Who is it?" "It's the nurse." I'm calling back and forth. Anyway, I got to the stairs, and I'm going to walk up the stairs to get to this apartment, and literally, Dale, the hair on the back of my neck stood up. And I thought, what is going on? I got all the way up to the top of the stairs, get in the apartment. There's thick blankets all around on the windows. People sitting in chairs with their hoods pulled down over their head. No lights on. Hunkered down. The girl is in, the young mom, 15 years old, in a back bedroom. She never turned around to look at me the whole time I was there talking to her. At one point, part of my assessment, I said to her, "So, did you take any drugs or drink or anything during your pregnancy? I'm just doing an assessment."
Mm.
And she wouldn't answer. I said, "Did you hear me? Did you smoke or drink or take any drugs, any substances during your pregnancy?" And she wouldn't answer. Her mother's standing in the room too. And I said, I don't really care personally. I'm not going to judge you one way or the other. I just want to make sure your baby
Mm.
has the services needed, right?
Yeah.
And her mother said to the daughter, "Oh, just tell her you smoked marijuana. She won't know the difference."
Alrighty then.
That type of stuff, we need to take that, put it together, and figure out how we can carry that kind of knowledge forward so that doesn't happen generation after generation
Yeah.
after
Yeah.
generation.
Yeah. 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 One of the things I really want to do with this is to help nurses like you and others to expose to other nurses the power that we have to get things done. If we only recognize that we have the power and have the willingness to get this done.
Yeah. Yeah. I'm all for it. If the time of us sitting around waiting for somebody to tell us what to do or to give us permission is past.
Yeah, it's long past. And as you said, we have the education to do it.
Yeah.
We have the education to take matters into our own hands and get it done.
That's right.
Put ourselves in positions and at tables and in rooms and wherever we need to be to influence stuff. We have that.
That's right.
So there you go.
That's it.
So, Miss Meryl.
Yeah.
Is there anything else you'd like to share with us?
No. Just thank you so much, Dale. I so appreciate what you're doing.
Thank you.
It's so great talking with you.
Thank you. I really appreciate your time today, and I love talking to you. So thank you so very much.
You are so welcome.